Thanks everyone. We are at the grand opening of ArchWell Health at the Eastway location in Charlotte. And the band, Too Much Sylvian, has just finished, and we are waiting for the presenter to come up and welcome us to ArchWell Health. Waiting for them. And thanks for watching.
Getting the tiger.
Attending with us today. We are very grateful that you are here. This is just a very exciting day for me and for our team. We've been waiting for this for a little while, so we are grateful that we have this opportunity to be here today. This will be the grand opening for the Eastway Charlotte Market Center. That's okay. Apologize for that. So we are here today to officially open our Eastway Center for ArchWell Health. It's the first of two ArchWell Health centers that are going to be supporting the Charlotte metro area. Without further ado, I want to make sure that we take a moment to recognize our public officials. I know we have Commissioner Gerald over here to my right. So that I don't miss anyone, if we have other public officials in the audience, including Chip, please take a moment to raise your hand and be recognized as well. I also want to take a moment to introduce the best team ever. So I'm going to take a moment to recognize our center manager, Cynthia McCoy, who is our membership experience manager. Peter Walker in the back, who will be our care navigator. Tiffany Austin is our care coordinator. And Dr. Asunyu is our physician here at our Eastway Center. I also want to make sure to recognize Kay Jumfrin, who is our market network manager for the Charlotte market. And then representing our second of two centers, which will be our North Graham location, is Sharon Forte. She's our membership experience manager there. And I don't see her, but Kenzie Luce is our center manager for the North Graham location. So as you can see, we have a great team here. They are ready to serve our seniors, and they are grateful to do so, and our seniors will be well taken care of at Eastway or at North Graham. Without further ado, it is also my privilege to introduce you to a gentleman whose vision and leadership were very instrumental in bringing a highly personalized, specialized care for seniors in underserved communities for the people of Charlotte. When you hear him speak, you will readily note that his great vision is equally matched by his passion, and we see this every day, personally. Speaking on behalf of all of us in the Charlotte area, I can say with all sincerity, we are inspired and energized by that passion and feel very fortunate to be a part of this exciting new day for healthcare in our community. And we, like him, are dedicated to providing a higher level of care for seniors at this Eastway ArchWell Health Center. Please welcome ArchWell Health's co-founder and CEO, Carl Whitmer.
I think we got the wrong person up here, right? I know, you should be upset. I know. Come on up. There we go. That's great. Good morning, and it's just a pleasure to be here. What an exciting day. I want to first of all thank everyone for attending and coming out this morning. It's a beautiful day. It's going to warm up, and it couldn't be a better day to be opening our center here at Eastway in Charlotte. So thank you for that. I also want to thank this team and all the other ArchWell Health colleagues in the room. You guys are the best, so thank you. You know, a lot of times folks ask me, my role here, and honestly, it really is what can I do to support our team, our colleagues, and how can we then take that support to then empower seniors to live life to their fullest. That's the ArchWell Health mission, and that's what's so exciting about this. So we're here to create relationships with seniors. We're here to create a great relationship between primary care physicians and their patients, and that's what this is about. It's about access, convenient access, close to home, near shopping, where it's easy to come see your primary care physician. So many times across the nation, frankly, and here as well, it's difficult for seniors to get to see their doctor. There's big, large medical office buildings. There's valet parking sometimes. There's parking structures. There's navigation through, complex health systems. And what we're trying to do is to make it easy. We're trying to make it accessible. We're trying to make it convenient. We're trying to do primary care where it is close to where you shop and other things so that you can really create that relationship with our physicians. And that's what's so important here. And that's what we're so excited about. It is a different way to really think about transforming the way primary care is delivered across the country. So that's meaningful, right? That's exciting, and relationships are what it's all about. We couldn't do this without the support of various officials and other colleagues and associates in Mecklenburg County and Charlotte and so forth. So thanks for all that support. We had great support from our contractor, our architects. ESA was the architect, Jay Dunn. I think some of those folks are here in the room, and they were instrumental in bringing both these locations to fruition and getting them started. So thank you all for that. Thank you very much. And then the other thing I would say, there's two other people really to recognize, and that is our medical staff. We're fortunate today to have, and I won't go through the group, but a number of our physicians from across the country here today to enjoy the grand opening, to be with the physicians, and really the second most important person, and really it's all about our relationship with prospective members here in the center. So people over 65 that are here visiting with us today, I don't mean to necessarily call out people that look over 65, but some of you know who that is. And so that's what this is about. It's to be your day and the relationship with you, bringing you into the ArchWell Health family is what's so important. The other thing I would tell you is that we want to make a difference. We want to make a difference in the community. We want to make a difference in your relationship with your primary care physician. And we want to create just a great patient experience. So access is important, patient experience is important, and relationships are important. So with that, I think the best segue here is to turn it over to Dr. Michael Lip. Dr. Lip, are you a physician, Champ? You're a doctor? No, doctor. Okay. All right. I think you could certainly do my job, but I'm not sure you can do their job, right? Okay, so I think Dr. Lip is our Chief Medical Officer, and he's going to say a few words about the way we think about caring for seniors. And I do want to make sure it's really important that I emphasize, we only see people over 65 years and old, and there's a reason for that. Those individuals need more time with their physician. They need more access to care. They need more convenient access to care. We're not trying to be a doctor to everyone. There are lots of physicians in the Charlotte market that do great work. What we really want to do is to take the time necessary to treat seniors and work with our payer partners in that regard that Jennifer will refer to in just a moment and recognize. But that's what this is about. So thanks so much for being here. Have a great day. We look forward to the grand opening, and I'll turn it over to Dr. Lynch.
So first of all, I want to say thank you to Carl for his vision of leadership and putting together such an amazing team. And personally, it's been a privilege to be part of that team to really develop this really innovative care model for seniors, because it's hard out there for seniors. Our healthcare system is complicated, it's challenging, it's expensive, it's confusing, and it's particularly confusing for seniors who often have to navigate that sometimes on their own. If they're lucky, they have family members to help them. And often they have to navigate the system while having their own health challenges and having their own social needs. And they need a better way, they deserve a better way. And we're going to deliver that here at ArchWell Health. Because in our centers, seniors will have time with their physician, they'll know their physician, they'll build a relationship, earn trust. The physician will explain things to them, get to know each and every member, what their needs are, what their desires are, get to know their family members, and offer them things that aren't just healthcare. Offer them social work, nutrition, exercise classes, the opportunity to be part of a community, because we built this entire care model not around the needs of the doctor, but actually what seniors need, and built an entire care team around what their needs are, and that's who we're here to serve. And that's not just about giving them good medical care, it's also about giving them a great experience. And that's giving them an experience that we think they probably never had before in healthcare, and we want to deliver that here. And that's driven by this great team here that's really passionate and dedicated to serving seniors. So let's give them a round of applause. And the doctors that are able to practice in this model, they often say that practicing at ArchWell Health is a type of medicine they thought they would be practicing when they decided to go to medical school. And they're able to practice that here. And the doctor in this center, Dr. Spora Sanju, who's right over here. Let's give her a round of applause. Just say a few words about Dr. Sanju, who is trained in internal medicine, an excellent physician. She has a really inspiring story, and she was actually one of the first doctors that we hired. And I remember one of the early conversations we had, I asked her about her approach to patient care. And she has a really interesting background. She actually, before she decided to go to medical school, was a nurse in various settings, telemetry, I think home health. And I talked about her approach to patient care, and she said that she learned about how to really take care of patients, actually being a nurse, how to really listen to them, learn about their family environments, get to know them and build that relationship. And that made her a better doctor when she decided to go to medical school. And so we're thrilled that she can bring that level of compassion to each and every member that we're going to serve here in this community. So thank you, Dr. Sun. So I'm going to turn it over now to Jennifer Feltz, our Market Growth Manager, for closing comments. Thank you.
Well, I just wanted to say thank you. Thank you all for coming out today. My name is Jennifer Feltz. I'm the Market Growth Manager for ArchWell Health in Charlotte. So thank you each for coming out and joining us with our celebration. I also want to thank Erica for coming out with Cigna and bringing her agent, Meredith, for coming out from United Healthcare along with your agents. I also want to do a special thanks for Sylvia for being here today and supplying us with the wonderful music. He really loves the music. So then most special thanks. I have 5 amazing people on my team. They're individuals that have been the face for ArchWell Health out in the community. They have been working hard and diligently for months. Some of them have been 5 months plus, living the ArchWell Health dream before we were actually even here. They were wearing their orange shirts, had a smile on their face, building relationships with the seniors, like Carl told you that we were going to be doing, and building that trust. Unfortunately, seniors have been taken advantage of, It takes time to build those relationships, and that's what they've done. So thank you all for the outstanding job that you've done. I'm going to name them, so if you would please hold off your applause until I'm finished naming them. I've got my first one who's not on the list. She's actually at the registration table. Her name is Robin. She is an outstanding community relations specialist that we have. She and I have actually known each other for several years, but she knows this community like the back of her hand. Mark Jarrell's shaking his head because he knows Robin. Her name is Robin Tolliver Ayatunde, so she is spectacular. My other amazing people are my membership consultants, and their names are Alicia Escamilla, if you would raise your hand. Then I have Lisa Ball, Evan Bowman, and John Giampalo. I have to practice that one. But anyway, let's give a round of applause for this outstanding team. Thank you guys. Y'all are making a difference. You're building relationships and you're impacting and making the seniors' lives that much better. ArchWell Health is all about helping seniors to connect and thrive and live healthier lives. So, I also want to, again, thank you all for coming out and joining us for our celebration. We're now going to proceed to the front of the building under the balloons where the leadership team and the center staff will perform the official ribbon cutting. After that, the public celebrations will begin. So thank you again.
Sound was actually. Okay, we're gonna sneak over here towards the ribbon cutting. Turnout today. There's at least 100 or so people here to watch this.
You want me to get closer?
Okay, we're about to see the ceremonial ribbon cutting. After this ribbon cutting, I believe we're going to go in and be given a tour of the community. The ribbon has officially been cut, and what a great group of people excited to serve this community, excited to serve the seniors that so desperately need protection and support. And we're going to step forward because I believe we are going to be one of the first that are going to be was introduced already as one of the client relationship coordinators. And Evan is going to give us a quick tour of the building. So is this a good time?
This is a great time.
Good.
So come on in. Welcome, guys. Here we have here, we're going to start off to the left. We're introducing Mr. Lambert. How we do this part? This is going to be our activity room here. So this room is going to be built in which we're going to host different activities from games, exercise classes, information seminars, but really for the seniors. So we're going to allow them to tell us what they would like to see. Not only they don't have to be a member to come to these activities, in fact, we want to use this to bring friends if they want. This is a great activity in which we can really stand to be another resource.
Almost as though promoting social and emotional health.
Absolutely, absolutely. Being part of a group of whole is going to be just as important. I'd like to speak. All right.
It's a little crowded, so we're going to dance it out.
So we're going to navigate through here. I'll come up to the front.
Okay.
You want me holding up here?
This looks like a nice reception area.
That's right. So this is our reception area, which we walk more seating. Here you can see behind us we have a Cigna and United Health. As we mentioned, we are going to be accepting Medicare Advantage plans. We're going to be a primary care doctor's office for seniors that are 65 and older. Okay. So basically, our whole model is we're going to provide longer time with the doctor. Provide more freedom. So we got Champ right now. There's the teacher. So this is special guest. That's right. This teacher will be the one that's answering the phone calls and booking the appointments. And the second will be the one that's organizing the activity room that we just mentioned. Just making sure that the seniors are having a great experience, helping them with all of everything that they have to utilize.
Your experience good as you come. And I'm the doctors. Where are the doctors? We're going to meet the doctors at the and I'm going to just pick up. I have two other people next
All right, so what Tiffany's role will be is if the doctor determines, hey, we might need to see a specialist after something like that, Tiffany's going to help make that a smooth transition, where she'll come in, she'll ask if they already have a specialist, then that she can book them an appointment. If they need transportation, she can help out with that. If they don't have a specialist, she's going to be able to find one close to their house with the help of Miss Page as well.
Coordination amongst different doctors. So are you saying that the doctor here might actually be in communication with the specialist to kind of coordinate care?
That's the goal. That's what everything we want, because not only what we're doing in here, we want to understand what they're doing there so we can all collaborate together. Very good. So we can step in here. You can see what an exam room looks like. Typical exam room, which will come in here and we'll review all their medical history, review their current medications, and just take your, do a normal doctor visit as is. So that, you'll have the whole care team coming in here making sure all their needs are met. All right, and we'll walk over here. So we have 4 exam rooms in each pod. And another awesome is we have a procedure room. So in this procedure room, you might say it's a little bit bigger. This procedure will be able to do some minor things like fingernail and toenail clippings, or if they have an abscess that needs basic wound care, or if they're dehydrated and need IVs. This is something that's just going to be able to give us that extra level of care of trying to do everything in-house and to just provide a better overall healthy living experience.
So where other doctors might refer them out to a hospital or urgent care, which is complicated.
Absolutely, absolutely. We're going to try to do as much as we can in-house. All right, so on our way over here,
about scheduling your next appointment.
we'll be able to actually meet the doctor. As you can see, that was pod number 4. So we're going to operate out of 4 pods. with 4 physicians eventually. So currently we have 1 physician hired and 1 care team, but as we continue to grow, we're going to go from 2 pods to 3 pods to 4 pods.
So it's a scalable operation.
Absolutely. This center,
For many reasons.
yes, the center has managed to hold up to 2,000 members, in which we're very excited to have that ratio of closer to 400 to 500 members per doctor, as opposed to some doctors are currently seeing 1,500 to 2,000 patients.
Wow.
All right, without further ado, we'd love to introduce you to Dr. Spora Asunju, and she'll be the physician here.
Dr. Sunji, thanks so much for speaking today. I haven't introduced myself to you yet, but I'm Rob Wachter, and I'm a seniors real estate specialist. One of the reasons we have this show and do these live broadcasts is because we work primarily with people 65 and over, helping protect them, their financial assets, their real estate assets, things like that. So we really want to support other organizations in the community that are doing the same. I'm really excited about what you guys have to do here. So could you tell us a little bit about yourself?
Sure. First of all, I want to thank you guys for coming. And it's a great day. Finally, thank you guys for coming. It's a great day. We're finally doing our grand opening today. Hopefully, it's like so ArchWell Health is a primary care geriatric care clinic, but we're doing it a little differently because we're focusing more on the quality of care rather than seeing many patients. We're more interested in keeping the patients healthy, living their best lives out of the hospital. And we're able to do this because we spend considerable amount of time on patients, to seeing our patients that they have, to make sure and we also have a support staff to help support
Insurance companies require that doctors see X number of people per hour, like 7.
like the game room for leisure,
So social, emotional, mental, and physical health.
holistic care.
So
That's what
right
we
now,
Well, thank you so much for talking to us today. I know from personal experience when my father was 80 years old and I had a little bit of medical background, and I felt like I don't know how he would have managed his care if I hadn't been there every step of the way, because he was just getting shuffled from one room to the next. So I'm really excited to hear these models here.
It's our pleasure. And we're making it easier for the seniors, transportation-wise. We're going to have the seniors who don't have transportation anymore to bring them. We're going to have more transportation. Not only to our clinics, but also to the specialists. So we're going to coordinate that care.
Supporting that, that's terrific. That's great.
We're happy to do that, and we're happy to fill the voice.
Looking forward to having you as part of the community.
My pleasure.
so like I said, we have.
Awesome, thank you for your time, doctor.
So this is considered.
Very good. As we kind of wrap it up toward here, at this way we also have a lab exam room in which we can order labs. So something that Dr. Asunju can review and see if they need to be sent out to a specialist. So as the center grows, more labs will become available. Different things to just make sure that they're living really well. Yes, sir. And as we head back out to the lobby. That's right.
Hey, Rob.
So it's bustling here, so we have refreshments and snacks. So again, I sincerely appreciate your time.